Hello and welcome to the HSJ Election Manifesto Health Check Podcast special. I'm Dave West, HSJ's Deputy Editor, and I have convened a group of our expert journalists for this Health Check Extra. Now all the general election manifestos are published to explore the health and social care proposals of the three main UK-wide parties. The manifestos are important, not because any government will necessarily follow to the line and letter what they have said, but they will, in one form or another, significantly shape, direct and constrain policy for the next period. So we at HSJ look at them very closely and are pleased to bring you and chew over in this HSJ Health Check special the detail from those three manifestos. I'm joined by HSJ editor Alastair McLellan, who yesterday afternoon and evening worked on the Conservative health policy manifesto. HSJ correspondent Sharon Brennan, who covered the Labour manifesto last week, and HSJ Bureau Chief Ben Clover, who worked on the Lib Dem manifesto for us. We're going to look at the three manifestos through the lens of three big themes in turn. Firstly, funding, secondly, staffing, and thirdly, reform. And let's start with funding. Like any general election, NHS funding and spending plays a big part in the announcements that are made, and we've seen Labour promise pretty substantial amounts for the NHS. We've seen, and other services, we've seen the Lib Dems make some commitments on NHS spending, and we've seen the Conservatives grab some headlines too. But Alastair, could I ask you first to take us through your analysis of the comparison between the parties' promises on funding?
So, thanks, Dave. When Dave says worked on, of course, he's referring to our journalistic endeavours rather than acting as a sort of policy spads. HSJ is always resolutely politically neutral on things unless we think something is really, really stupid. So, there's been a lot of comment about the amount of funding promises in the Labour Party manifestos and the lack of those in the Conservative Party one. There was a feeling, I think, that many thought that Boris might try and outspend Corbyn, that this was very different from the parsimonious regime of May and Hammond. But it hasn't proved to be thus. For every £1 the Tories are proposing to invest, Labour are proposed to invest 28. So it's an enormous difference. Now, the difference isn't that great in healthcare, but it is great in most other areas of public sector spend. Now, as people who listen to this podcast will know very well, many of the NHS's problems owe their genesis to problems that arise in other parts of the public sector. Austerity will still firmly be present for all other aspects of the public sector should the Conservatives get back in. And therefore, although the Conservatives' funding is only a little less in sort of huge NHS terms than the Conservatives, because of what's happening what would be happening elsewhere in the public sector, I feel it might feel significantly lower, because the kind of problems that the NHS will having to be deal with will be of a greater and wider sort, as we've seen in the last few years.
They would. The other party's response to that would be that the question of whether Labour can really spend all that money that they're committing to spend is a realistic prospect of them lifting up the entire public sector across the board.
Well, of course, as we have seen in this general election, the counterclaim on both sides have been sort of an existential threat. One, that the to the NHS. One, that the NHS would be sold off to Donald Trump, and from Tories to Labour that the spending plans would crash the economy. Obviously, if these spending plans did crash the economy, that would be the worst possible news for the NHS. But if it didn't, then clearly the amount of spending that Labour is doing outside the NHS even if a lot of it might be wasted, which is often happens when you have massive spending splurges, as with the NHS in the noughties, it's still going to feel significantly better, is my view.
Okay. Ben, where did the Lib Dems pitch themselves on the funding question?
Sort of in between the two. So it's a £7 billion a year additional revenue is what the Lib Dems committed to, plus 10 billion capital, 10 billion from their capital fund. The interesting thing about the Lib Dem promise on revenue is they say it'll be raised from an extra 1p on income tax and will be hypothecated, which is a word policy people get excited about, but basically just means ring fenced, and it will be tied to the amount that is raised through general taxation. Now, the Lib Dems got, I think, perhaps a slightly unfair mauling from some of the think tanks on this, saying why this would tie them to, if there was a lowered tax take, to lower amounts of funding for the NHS. And I'm not sure that's an entirely fair reading of what their manifesto pledge was, because it said it was 7 billion, and I'm sure if it came in less than that, then they could decide to top it up. But yeah, 7 billion within that ring-fenced amount would be another ring fence for mental health spending, which is something they major on, but we'll come on to in a minute.
Okay, thanks.
Sorry, Dave, just on mental health, we're deliberately not going to talk a lot about mental health in this podcast, because we're recording a special podcast at the Mental Health Summit on Thursday, in which will be devoted almost entirely to the subject.
So moving on though to what we're going to get from the money in other areas, and particularly to staffing, and staffing and workforce have played a big part in each of the manifestos again, as they often do, but perhaps even more so with that being a huge and very widely acknowledged problem now for the NHS. It's lack of staff. And I think Alastair, you're going to kick us off with some thoughts on the staffing promises.
Yeah, so I will leave the debate about the 50,000 more nurses aside. Individual podcast listeners can judge whether they think, including people already working in the NHS and people who will have to be exported from outside the UK, can be counted in a 50,000 more nurses claim. It's also worth noting that the money that's put aside is money to train those nurses, not to pay them. That money would have to come out of the existing NHS budget.
On pay, the Labour make a big commitment on pay, which perhaps
so the most significant promise within the Labour manifesto that had any kind of detail was it. Although it was very little detail, was a offer of a 5% pay rise for all public sector staff. Now, the public sector bill is 230 odd billion pounds a year. So saying that you're going to add a 5% increase to it is a very significant number. The NHS pay bill, roughly about £50 billion. So I asked those behind the Labour Party policy to explain a little to me, and I learnt this, that if there was a Labour government, a majority Labour government, at the start of the next financial year, there would be a sum of money, £2.5 billion, or thereabouts, in other words, 5% of 50 billion, which would be available for the health secretary to pay NHS staff. That does not mean that every NHS staff member instantly gets a 5% increase. Basically, they will be able, the health secretary will be able to determine, in conjunction, of course, with the unions, Labour people add, who gets what money. And sort of quick conversations around the union thing, around the union side of things, soon uncovered that there's quite a lot of, there's a lot of pent-up demand there, shall we? And people saying, actually, our members deserve a lot more than 5%. So we have seen them give figures for student nurses and junior doctors. So I suspect they've painted themselves into the corner there. Somebody who was good with these kind of things could work out how much of their £2.5 billion they've spent by giving those 5% pay increases to junior doctors and junior and trainee nurses, student nurses, see how much they've got left over. But this is all going to get wrapped up with the contract negotiations, agenda for change, medical doctors' contract negotiations, agenda for change negotiations, about what kind of deals they might do if they try and bring outsourced staff back into the NHS. So there is, the money will definitely be there. The money is definitely on top of the £26 billion they've promised, but the idea that it's going to be evenly distributed across the NHS, that's not going to be the case. In fact, given that there are some pay rises already factored in, obviously pay rises factored in theory, some people could actually end up with less than they are expecting to get, because a new government could decide whatever, a group of people who are meant to be getting 2% actually should only have 1%, so they can pay somebody else 4%.
Okay, thanks. And Ben, did the Lib Dems have much to say about staffing and workforce?
There weren't a whole lot of numbers in the Lib Dem workforce bit. All of their hypothecated tax was pledged for fixing the gaps in workforce. I mean, they say they'll sort out GP numbers by 2025. That's one of the closest bits to a firm commitment. They too are going to bring back bursaries and extra help for student nurses. So it sounds like that will happen no matter who gets into or what combination.
I don't know if there's a different flavour there, because the Conservatives are talking about bringing back a maintenance grant, not paying off tuition, not removing tuition fees, which was part of what was abolished a few years ago. I don't know if the...
Well, this would be a bursary, so yeah, maybe the technicalities of the differences. You could fall down those, I guess. Well, something I didn't see anywhere else was a sort of, and this could make a real difference to the services in parts of the country, is a patient premium, which would be specifically for paying staff more to work in some parts of the country, which is because the workforce crisis doesn't fall evenly across the NHS at all. There's large parts of a service which is staffed purely by one locum consultant.
And burying that in itself is quite controversial to try and implement.
Yeah, it's controversial just within the inner and outer London weighting. So trying to apply it to like inner and outer Lincolnshire, but nonetheless, it's a pledge they made.
Okay, and we should talk as well. Mention, I think, the Conservative proposals, because they've got a whole kind of section of our NHS people plan, and it's really tying themselves into the work that's been going on in the NHS about the people plan, and their sort of commitments about retention, and I think the wording about management is more supportive management or something like that, but they're clearly getting a little bit into the sort of cultural change there as well, and a commitment about morale and that sort of thing. I don't know if you picked up any observations there, Alastair.
The tone of sad man that I am, I spend a lot of time studying not only the contents of manifestos but their tone as well, and it made me smile that in the past typically a Tory party manifesto would go on about the number of managers and suggest that there were too many and that they should be curbed, etc. In 2017 we got a sort of "and we will hold them to account" type message. In other words, May Hammond, we're grudgingly going to give them some money, but we're jolly well going to hold these NHS managers to account for every penny they spend. And then in this manifesto, there's almost none of that at all. It's a very touchy-feely approach. Yes, that single reference to supportive management is the sort of one, it's a little tiny bit left over from the red in tooth and claw.
We shall reform you.
Management bashing Tories of the past. Both manifestos, of course, are incredible examples of the journeys the parties have travelled on the NHS in recent years.
And Sharon, what about the immigration dimension to the workforce?
So the Tories are saying that they would like to bring in a Australian-style point system. They've already realised this may affect the NHS quite significantly, and are promising an NHS visa, which would be for trained GPs, nurses, AHPs, and those kind of people, to reduce the cost of coming in and also to speed up the process. I think what they've actually missed here is that they have no similar pledge for social care, and domiciliary care is quite often supplied by migrant labour, often low-skilled and often poorly paid, and there is no mention as to how they're going to support the social care workforce, which wouldn't qualify for this visa scheme or for the wider high-skilled visa proposals they're attaching.
Okay, well let's move on to the pretty broad headline area of reform.
Sorry, Dave. Before we do that, could we just talk briefly about pensions? Because I think that is one area where, again, the differences in tones of the parties is very clear. Is that the Tory party are very clear that they say within weeks of us regaining power, we would be engaging in an urgent review. And it talks about BMA, talking with the BMA and the Royal College Academy of Royal Medical Colleges, whereas Labour were very gentle. We recognise there's a problem, or we will attempt to review it. I think that word urgent that appears in the Tory one and doesn't appear in the Labour one is a real. All the Tories care. The Tories don't. Tories just need the NHS to perform. If that means paying doctors more money at the exclusion of other staff, so be it. They don't. That the key thing is with Labour and all their much of their support coming from staffing organisations, there is incredible pressure to not signal out and give favourable treatment to the most highly paid people, who they're going to tax more heavily anyway. And I think it's a real. We can see quite how angrily the NHS has reacted to, I think, NHS England's well-intentioned proposals on trying to sort out the pensions, the short-term ones for this year. And I think, there'll be different problems there'll be different problems for different parties. But as you can see, there'll be problems of different natures. One is the Conservatives will probably just take the tape away for doctors and have to deal with the row that creates around with all the other people who are involved. Obviously, not only in the NHS. On the Labour side of things, they'd have to square everybody off, and that's obviously going to take a long time. And the need to change things around is really, really urgent. And as we've seen in the responses to the initial offer, people are going to take they're going to need a cast iron offer with no prevarication or uncertainties to say to sign up to it.
Particularly with moving on to the reform area, particularly with Labour, a particular issue for them having committed to get back to meeting the targets, and the area of reform covers quite a few different things from different parties' point of views. But we're talking about changes to what they're actually proposing to do to the NHS. We're talking about legislative proposals where they feature in the manifestos, and about things like integration and the way the NHS structures work. And starting with Labour, I mean, there's an absolute swathe of quite generalist proposals. I think if you want to start us off with that, Alastair.
It was interesting, of course. I looked for a commitment to meet waiting time targets in the Labour manifesto, expecting to find it. It wasn't there. And then until somebody actually pointed out to me that the word constitution had been left out of the Labour Party manifesto. So yes, they are signed up to those constitutional targets, which very significantly the Conservative Party does not do. Did in the 2017 manifesto, but not in the 2019 manifesto. it makes reference instead to reviewing the Powys review of targets that are going on. But it is it's very clear from the manifesto, and even more clear from the spending announcements that were made by Jonathan Ashworth and John MacDonald just before the manifesto, that this is quite sort of old school stuff, really. They want to spend, sort of Blairite Brown stuff, they want to spend the money on getting waiting lists down. They don't particularly want to spend the money on creating integrated care systems. In fact, they say something nasty about integrated care systems.
Do you think we should read much into that paragraph about, we don't like the way indicating the long-term plan is being nefariously used in the way that the sort of conspiracy theorists suggest for privatisation?
Well, I was speaking to a Labour Party policy figure who, with sort of, wearily explained to me that I had to understand that Labour Party policy was made in a different way than party policy was made in the Labour Party in the past and in other parties, in that the membership would take a view, and that view had to be factored into whatever policy is put forward. So, and that really means if somebody kicks up a fuss about some element of STPs or whatever, then we're going to have to reflect that in our thinking. So much of the narrative has been within the Labour Party, the left of the Labour Party, which now controls the party, that the Conservatives were privatising the NHS and we're going to use STPs and ICSs as a vehicle of it, which of course is rubbish. But that's so much part of the narrative that it would have to be reflected in any Labour response to the STPs, ICSs. Now, it might be that if the campaigners are given their NHS reinstatement bill and they change a line that says the Health Secretary is now responsible for delivering universal health services, and the last vestiges are washed away, the lands reforms are washed away, and they rename them People's Transformation Plans or Universal Care Systems or something like that, then that'll be fine. Quite honestly, and I think this is what the policy person was trying to tell me, is we don't really know how policy making is going to work under if this Labour Party formed the government, because it's a very, very, very different party to anyone that would have ever held power in this country beforehand.
Okay, thanks. And Sharon, you cover the area of integration and all related to that for us. What are you saying there? The manifesto for Labour seemed quite confused, as Alastair was saying. It used the word that integrated care systems are going to be a cover for privatisation, and it also suggested that it would like them to be run by public sector bodies, which is actually not that far off from the legislation that is currently being proposed for government anyway, because that would see ICS becoming a statutory body. So it does seem, as Alastair said, quite confused as to where they're coming from. Again, they're committed to repealing the Health and Social Care Act. I can't imagine anyone in the NHS is supportive of that idea, and more importantly, how they're going to get
supportive of that.
Yeah,
not supportive, and how they're going to get round to meeting waiting times when they want a massive top-down reorganisation again seems to be completely incompatible.
Well, I'm sure they'll be keen to avoid top-down reorganisation, as of course will the Conservatives, who are proposing to bring forward the NHS England legislative changes within 3 months. I mean, it really struck me. Within 3 months, we will have enshrined in law our NHS long-term plan. It's funny they've started to call it our NHS long-term plan, when previously it was the NHS's long-term plan,
Simon
Stephenson's long-term plan they could hold to account to. But Dave, you're the expert on this area. What are the sort of headlines changes that potential legislation might contain?
Yeah, the NHS England proposals, the biggest aspects are to remove the strongest but the majority of competition and procurement legislation around the way the NHS procures clinical services, that the famous Section 75 from the Health and Social Care Act, to remove the role of the Competition and Markets Authority from pretty much all of what the NHS does, to various pretty technical changes which relate to enabling integrated care systems. They don't, it is not a top-down reorganisation of structures, because they don't actually abolish anything or create any new statutory organisations by the passing of that legislation. You just enable people to work together in different ways, and as Sharon was alluding to create a sort of new type of trust to run an integrated care sort of provider, but it's not going to happen in many cases anyway. And then quite a whole a range of sort of technical things about directing foundation trusts on how they spend their capital, and things like that. I mean, I think in summary, it's pretty far-reaching changes to pass in 3 months, as you say, and surely there would be an implementation period even for that. On the competition front, you're replacing competition rules with something called a best value test, which NHS England has basically has acknowledged needs to be renamed, and no one's come up with a good name for it yet, because people think value means cuts. And nobody, let alone define how you actually decide what good value is, or when you need to take your decision about what good value is.
Back to the debates I remember in the 1980s, and the contestability debates, and where you have to try and determine in a sort of what's the balance between cost and quality. I think there is this, because we've lived with it for so long, there's this idea that if the internal market goes away, everything will be really easy to do. The judgments required about what you do, when you do it, where you do it, and who do it, they're all still going to be there. Yeah. Just because they aren't in a contractual form doesn't mean they won't be any less difficult than they already are. Yeah. But that's probably a subject for another podcast.
Briefly in the Labour manifesto and the social care section, I thought it was a sort of reasonably sensible proposals about the way to treat private sector provision, as well as Labour's got much more extensive proposals about how to actually fund social care in the long term, a huge sort of bigger mission from the Conservatives. But they also talking about, because social care being majorly privately provided, they said, look, we do want to gradually increase public provision, whether you think that's practical or not, but they would put on certain requirements around transparency and sort of the behaviour and integrity of private providers of social care, and perhaps around sort of profit capping, which I'm sure would be highly controversial with those organisations. But actually, in the NHS, providers have come to arrangements in the past about limiting the amount of profit, which they rarely make a great deal of profit from the NHS anyway. But there's sort of potentially a practical approach to some.
Well,
of this
again, there's a phrase which has escaped my aging memory, but again, during the 80s and 90s, there were lots of debates about, as outsourcing began, about the kind of rules that you could place or commitments that you could place on contractors in terms of how they treated their staff and how they went about their work and things like that, and didn't really come to much actually, but it was a big debate about it, and I could imagine if we had a Labour government, it would return in full force. There would be an approach, well, if we have to use the private sector, we're going to make sure that private sector operates as much like the public sector as we possibly can.
There's a line about agenda for change.
Many people think was a good thing.
Ben, did Lib Dems throw any reform proposals in there, ideas? I think there was often interested in local democracy as part of the NHS.
That wasn't all that specific about like the verbs were things like encourage and rather than any kind of firm commitment. I thought the more interesting stuff was about the more waiting times targets and mental health, which I won't say anything more about because there's a whole podcast on that coming up. But also just the statutory independent Office for Budget Responsibility for Health, meeting every 3 years and making binding sounding judgments.
Which was a commitment in the 2017 Labour Party manifesto, and is not a commitment in the 2019 Labour Party manifesto. That together with the dropping of the mysterious NHS Excellence watchdog. I know we're very upset about the loss of NHS Excellence. It's been cut from history before it was even born. But who knows? Who knows?
There's a very sad lack of new quangros across all three manifestos, I think.
There will no doubt, should we have a Labour government, be the need. There will no doubt be a new body created of some kind. And it's useful for them to have a name ready on the cutting floor that they can just quickly cut and stick on the door. NHS Excellence. I think NHS Excellence will be back.
Excellent care systems. Perhaps have 40, 50 of them. Okay, come to the end of our half hour for today. Thanks for joining us, and please do join again on Friday morning when we'll be talking lots more about the mental health proposals in the manifestos coming from HSJ's Mental Health Summit later this week in Leeds. So speak to you soon.
And subscribe if you haven't already.